Have you ever woken up in the middle of the night and felt a sharp, biting pain right in your hip? Or perhaps it is a dull, constant ache that travels all the way down to your toes? You try to move, you try to stretch, but the pain is stubborn. It feels like a thief, stealing your mobility and your joy. You ask yourself, is my hip joint wearing out? Or is it that famous sciatic nerve causing all this trouble? Welcome to Wellness Roots Journey. I am so glad you are here. Today, we are going on a deep dive. We aren't just looking at symptoms, we are looking for truth. Because here is the reality. Treating sciatica, when you actually have hip arthritis, is like trying to fix a leaky pipe by painting the walls. It might look better for a second, but the problem remains. Before we unlock these secrets, please take a moment to like this video and subscribe to our community. Your support helps us reach more people who are struggling just like you. And if you have a moment, tell me in the comments, where do you feel the pain most? Is it in your groin or your buttock? Your answer might help someone else feel less alone. Now, let's look at Margaret. Margaret is 72 years young. She loves her garden. But lately, the garden has been lonely. Every time she tries to bend over, a shock, like electricity, shoots down her right leg. She went to her doctor, and he said it might be wear and tear. But Margaret is smart. She knows that wear and tear is a very broad term. Is it the bone or is it the nerve? In this video, we're going to give you the scientific markers, the clinical clues that doctors use to tell the difference. We will explore why sitting might be your worst enemy if it's sciatica, but walking might be the trigger if it's arthritis. By the end of our 30 minutes together, you will have a clear map. You will feel empowered. No more guessing, no more fear, just clarity. There is so much hope for your future. You are not broken. You are simply in need of the right information. Let's start with the anatomy of the crime scene. Let's look at the hip and the nerve and find out who is the real culprit. Imagine, for a moment, a perfectly engineered machine. The hip joint is exactly that. It is a ball and socket masterpiece designed to carry your entire weight while allowing you to dance, to walk, and to climb. In a healthy hip, the ends of your bones are covered in something miraculous called articular cartilage. This cartilage is smoother than ice. It is slippery, tough, and it acts as a shock absorber. It is bathed in a special fluid, like the finest oil in an engine, ensuring that every step you take is silent and effortless. But as the years pass, or perhaps due to an old injury, that smooth surface begins to change. This is what we call osteoarthritis. Think of it like a rusty hinge on an old garden gate. At first, you might only notice it on cold mornings. The cartilage, once thick and bouncy, starts to wear thin. It becomes frayed like an old carpet. Eventually, the bone begins to touch. Bone. When this happens, your body tries to protect itself. It grows tiny, jagged bits of extra bone called spurs. These spurs are the sand in the gears. They make the joint feel stiff, especially when you first get out of bed or after you've been sitting in a car for a long drive. Now, here is the most important clue. If the problem is in the joint, you will almost always feel the pain in your groin. Many people are surprised by this. They expect hip pain to be on the outside, near the pocket of their jeans. But true hip arthritis hides deep in the front. It might feel like a sharp pinch when you try to put on your socks, or a dull, deep ache that makes you limp after a long walk in the park. According to the American Academy of Orthopedic Surgeons, this groin pain is the hallmark of hip decay. It doesn't travel down to your ankle. It stays localized right there where the leg meets the torso. Margaret felt this every single morning. She felt like she needed WD-40 just to get to the bathroom. It was a feeling of being locked. But what if your pain is not in the groin? What if it feels more like an electric wire being pulled tight from your back all the way to your heel? If that sounds more like your experience, then we are no longer talking about a rusty hinge. We are talking about a pinched wire. Let's move our focus from the bone to the nerve. Let's talk about the famous and often misunderstood sciatic nerve. Now, Let us leave the rusty hinge of the hip joint behind and look at a completely different kind of problem. Imagine a great highway of information starting at the base of your spine and traveling all the way down to your big toe. This is the sciatic nerve. It is the longest and the thickest nerve in your entire body. In most people, it is as thick as your thumb. Because it is so large, it has a lot of responsibilities. It tells your muscles to move, and it tells your brain what the skin on your leg is feeling. But because it is so long, it is also very vulnerable. While arthritis is a problem of the bone, sciatica is a problem of pressure. Imagine your spine is like a stack of blocks, and between those blocks are soft, squishy pillows called discs. These discs are supposed to stay in their place. But sometimes, due to age or a sudden movement, one of those pillows bulges out. It doesn't take much. Just a tiny bit of pressure against that thumb-sized nerve, and suddenly the information highway is on fire. This is the electric shock that Mr. Henry feels. Unlike Margaret's dull, deep groin ache, Mr. Henry's pain is unpredictable. It feels like a lightning bolt shooting from his lower back, through his buttock, and down the back of his leg. Sometimes, it travels all the way into his calf or makes his toes feel like they are asleep. Have you ever felt that pin-pons or needle sensation? Or perhaps a patch of skin on your leg feels numb as if it doesn't belong to you anymore? This is a major clue. Hip arthritis almost never causes numbness or tingling. Arthritis is a mechanical pain, but sciatica is a neurological pain. It is the sound of a nerve screaming for space. According to the North American Spine Society, sciatica is often triggered by simple things. For Mr. Henry, it was sitting on his favorite soft sofa for too long. That deep, comfy cushion caused his spine to slump, pushing the disc further against the nerve. Even a sneeze or a cough can send a sharp jolt of pain down the leg because it momentarily increases the pressure in the spinal canal. If you are watching this and thinking, "That's IT," that is exactly what I feel, then stay with me. Because knowing it is a nerve issue is the first step toward the right relief. You see, if you try to stretch the hip when the nerve is the problem, you might actually make it worse. You might be pulling on a wire that is already tight. In the next few minutes, we are going to perform a symmetry test. We are going to look at the movement of your body to see which one, the bone or the nerve, is truly crying out. But first, ask yourself, does your pain travel past your knee? If the answer is yes, the mystery is starting to unravel. Let's look at the clues in motion and see how your body reveals its secrets. Now, it is time for the moment of truth. To find out what is really happening inside your body, we must look at how you move. Doctors call this the symmetry test, and it is one of the most powerful tools we have. Let's start with a very simple question. Where does it hurt when you try to put on your shoes? Imagine Margaret. When she tries to lift her foot and cross her ankle over her knee to tie her laces, she feels a sharp, deep pinch right in her groin. It feels like the joint is stuck, like a door that won't open all the way. This is a classic sign of hip arthritis. In the medical world, we call this a reduced range of motion. Because the cartilage is worn away, the bone literally hits bone and your body says, stop. Now let's look at Mr. Henry. He can cross his legs just fine. His hip joint moves smoothly. But if Mr. Henry lies down on his back and someone tries to lift his legs straight up toward the ceiling, he gasps in pain. Why? Because as that leg goes up, the sciatic nerve is being stretched. It's like pulling a tight wire through a narrow hole. If that nerve is already pinched in your back, stretching it makes the pain explode down your leg. Do you see the difference? Arthritis is about rotation. If you find it impossible to point your toes inward or cross your legs without that deep groin pain, the culprit is almost certainly your hip joint. According to the Mayo Clinic, this loss of rotation is the single most reliable way to identify hip decay. Sciatica, on the other hand, is about tension. If you can move your hip in circles, but you cannot straighten your leg without a shock, then the nerve is the one crying for help. Think about your daily life. When you walk, does your hip feel like it's grinding? Or when you sit down, does your leg start to feel like it's on fire? Margaret's hip hates movement. The more she walks, the more that rusty hinge hurts. But Mr. Henry's nerve hates pressure. The longer he sits, the more that disc pushes against his nerve. This is where many people get stuck. They try to stretch their hip pain away, but if they have sciatica, stretching might be the worst thing they can do. They are pulling on an angry nerve. Understanding these movements is like having a key to a locked door. You are no longer a victim of mysterious pain. You are becoming an expert on your own body. But what if you have both? It happens more often than you think. And there is one secret place that causes pain for both Margaret and Mr. Henry. In the next segment, we are going to look at the hidden muscle. That often confuses everyone. Is it your hip? Is it your back? Or is it a tiny muscle hidden deep in your seat? Let's find out, and let's find your path to relief. So far, we have looked at the bone, and we have looked at the spine. But what if I told you there is a third culprit, a hidden imposter that hides deep inside your seat and mimics both arthritis and sciatica? Meet the piriformis muscle. It is a tiny pear-shaped muscle located deep behind your big gluteal muscles. Its job is simple. It helps your hip rotate outward. But here is the catch. In almost everyone, the massive sciatic nerve passes directly underneath this muscle. If this muscle becomes tight or inflamed or goes into a spasm, it acts like a pair of pliers. It reaches out and it squeezes the nerve. Doctors call this piriformis syndrome, and it is one of the most common reasons why people like Margaret and Mr. Henry get confused. Think about your own pain. Do you have a hot spot right in the middle of your buttock? Does it feel like you are sitting on a sharp rock? When you walk or climb stairs, does that deep muscle ache and then send a tingling sensation down your leg? This is the imposter at work. It feels like hip arthritis because it hurts when you rotate your leg. And it feels like sciatica because it irritates the nerve. But the source is not your joint, and it is not your spine. It is a stressed muscle. According to the Journal of Orthopedic Surgery, many patients who think they need back surgery or a hip replacement actually just need to relax this tiny muscle. How do you know if it's the piriformis? Try this. While sitting, cross your painful leg over your other knee and gently lean forward. If you feel an intense, deep stretch right in the center of your buttock, you have found the hot spot. This is actually good news. Why? Because a muscle is much easier to fix than a worn-out joint or a herniated disc. With the right stretches and perhaps a simple tennis ball massage, that pliers grip on your nerve can be released. Margaret tried this, and for the first time in months, she felt the electric shock in her leg begin to fade. She realized that her body wasn't falling apart. It was just tight. Can you imagine the relief? To know that you don't need a hospital, you just need a better understanding of your own anatomy. But we must be careful. We cannot just guess. We need to be certain. In our next segment, we are going to look at the danger signs. The red flags that tell you it is time to stop the home exercises and see a professional immediately. Are you ready to separate the aches of aging from the signals of emergency? Let's keep moving forward on your journey to healing. Now, we must have a very serious conversation. While most cases of hip pain and sciatica can be managed at home with patience and the right movement, there are times when your body is sending a shout for help. Doctors call these red flags. If you experience any of the symptoms I am about to describe, please stop what you are doing and seek professional medical attention immediately. This is about protecting your long-term health and your independence. The first red flag is what we call saddle anesthesia. Imagine the area of your body that would touch a saddle if you were riding a horse. If you feel a sudden numbness or a loss of feeling in your groin, your inner thighs, or your seat, this is an emergency. It could mean that the bundle of nerves at the base of your spine is under severe pressure. The second red flag is a sudden loss of bladder or bowel control. If you find that you cannot hold it, or you have lost the sensation that you need to go, do not wait. This is not a normal part of aging, and it is not just a bad back. It is a sign of a rare condition called cauda equina syndrome, and it requires urgent care to prevent permanent damage. The third red flag is extreme muscle weakness. We aren't talking about feeling tired. We are talking about a foot that drags on the floor, or a leg that suddenly buckles when you try to stand. If you cannot lift your toes, or if you find yourself stumbling frequently, the nerve signal to your muscles is being cut off. Finally, look for signs of infection or fracture. If your hip pain is accompanied by a fever, or if the skin over your joint is red and hot to the touch, there may be an infection inside. And if your pain started after a fall or a trauma, even a minor one, we must rule out a fracture, especially if you have a history of osteoporosis. According to the Mayo Clinic, these symptoms are rare, but they are critical to recognize. Margaret and Mr. Henry both took a moment to listen. They realized that while their pain was frustrating, it wasn't an emergency. Knowing the red flags gave them a sense of safety. It meant they could focus on their exercises without the fear that they were ignoring something dangerous. You see, knowledge is your best defense. By knowing when to call the doctor, you are taking control of your own journey. If you are not experiencing these red flags, then we have reason to be very hopeful. Most pain, even intense pain, can be improved. In our next segment, we are going to look at the science of recovery. We will explore the latest evidence-based treatments for both arthritis and sciatica. Are you ready to move from finding the problem to finding the solution? Let's talk about how to get your life back. Now, we arrive at the most exciting part of our journey together. The part where we move from knowing to doing. Because the truth is, your body has an incredible ability to heal if you give it the right environment. Let's talk about the science of recovery. For Margaret and her rusty hinge of hip arthritis, the science is very clear. According to the British Journal of Sports Medicine, movement is actually the best medicine for a worn-out joint. Why? Because your joints do not have a direct blood supply. They get their nutrients through imbibition, which is a fancy word for pumping. Every time you move your hip, you are pumping fresh, healing fluid into that cartilage. This is why low-impact exercise is so powerful. Swimming, cycling, or simply walking on a flat surface can actually reduce the pain of arthritis over time. It strengthens the muscles around the joint, taking the pressure off the bone. But what about Mr. Henry and his electric wire? For sciatica, the goal is different. We aren't trying to pump the nerve, we are trying to decompress it. The North American Spine Society emphasizes centralization. This means performing specific movements like the cobra stretch that encourage that bulging disc to move back toward the center, away from the nerve. Have you ever heard of nerve gliding? Imagine your nerve is like a silk thread that has become stuck in some honey. Nerve gliding exercises gently floss that thread back and forth, breaking up the sticky spots and restoring blood flow to the nerve fibers. It is a gentle, rhythmic movement that tells your nervous system it is safe to relax. But recovery is not just about exercise. It is about environment. Margaret started eating more anti-inflammatory foods like salmon, turmeric, and leafy greens. She wanted to reduce the fire inside her joint from the inside out. And Mr. Henry? He changed how he sits. He stopped slumped over on his soft sofa and started using a firm chair with a lumbar support. He realized that his posture was the hidden finger that was constantly poking his nerve. Can you feel the hope in these solutions? They don't require expensive machines or risky procedures. They require consistency. They require you to listen and to respond with kindness to your body. But I know what you're thinking. Which one should I do first? In our next segment, we're going to build your first 24-hour plan, a step-by-step guide on how to manage your pain, starting the moment this video ends. Are you ready to take your first step toward a lighter, easier life? Let's build your plan together. So you have the knowledge, you have the diagnosis. Now, what do you do in the next 24 hours to start the healing process? This is your action plan, and it starts the moment you wake up tomorrow morning. If you are like Margaret and your hip is the problem, do not jump out of bed. Your joint has been resting all night and it is stiff. Instead, while still lying down, gently hug your knees to your chest. Rotate your ankles. Think of it like warming up the engine of a car on a cold winter day. When you finally stand up, move slowly. Give that synovial fluid a chance to coat the joint, but if you are like Mr. Henry and it's your nerve, the morning is about support. When you get out of bed, keep your spine straight. Do not bend over to pick up your slippers. Instead, hinge at your hips. Keep that information highway in your back as flat and calm as possible. During the day, follow the rule of 30. Every 30 minutes, change your position. If you are sitting, stand up and walk for 2 minutes. If you are standing, sit down and rest. Movement is life, but variety is the secret to recovery. According to the Cleveland Clinic, short, frequent walks are far more beneficial for chronic pain than one long, exhausting hike. Aim for 5 minutes, 3 times a day. It seems small, but for a worn-out joint or an angry nerve, it is a miracle. Now let's talk about temperature control. If your hip feels locked and rusty, try heat. A warm shower or a heating pad will relax the muscles and increase blood flow. But if your leg feels on fire or like a sharp electric shock, reach for the ice. 15 minutes of a cold pack on your lower back can help shrink the inflammation around the nerve root. As the sun sets and you prepare for sleep, your goal is neutrality. If you sleep on your back, put a pillow under your knees. This flattens your lower back and gives the sciatic nerve more room to breathe. If you sleep on your side, put a pillow between your knees. This keeps your hip joint in a straight line, preventing that groin pinch that wakes Margaret up in the middle of the night. Margaret and Mr. Henry followed this plan for just 1 day. They didn't wake up cured, but they woke up with a sense of control. They weren't fighting their bodies anymore. They were working with them. Can you commit to just 24 hours? Just 1 day of being kind to your joints and gentle with your nerves? In our next segment, we're going to look at the mental game, because living with pain is exhausting. We will talk about how to stay motivated even on the hard days. Are you ready to strengthen your mind as well as your body? Let's talk about the power of resilience. We have talked a lot today about the bones, the joints, and the nerves. But there is one more part of you that is just as important in this journey to relief, and that is your mind. Living with pain is exhausting. It isn't just the physical ache. It is the mental toll of wondering if you will ever feel like yourself again. It is the frustration of needing help to do things you used to do without even thinking. Margaret felt this on the days when her hip felt like it was fused together. And Mr. Henry felt it when the electric shocks in his leg made him afraid to leave the house. But here is a truth that modern science is now confirming. Your brain is the volume knob for your pain. When we are stressed, when we are fearful, or when we lose hope, our brain turns that volume knob all the way up. A small pinch can feel like a sharp stabbing because our nervous system is on high alert. According to studies from Harvard Health, practicing mindfulness and deep breathing can actually turn that volume knob down. When you take a slow, deep breath, you are sending a signal to your entire body. You are saying, I am safe, I am in control, and we are healing. Recovery is not a straight line. It is more like a mountain path. There will be days when you feel wonderful and you think the pain is gone forever. And then there might be a day when it flares up again. On those hard days, do not let the old fear back in. Do not think, I am back at the beginning. You are not. You are just on a different part of the path. Margaret started keeping a small wins journal. One day, she wrote, I walked to the mailbox without leaning on the fence. Another day, she wrote, I slept for 6 hours without waking up. These tiny victories built a shield around her heart. They reminded her that she was winning even when the joint was still stiff. Remember, your body is listening to what your mind is saying. If you tell yourself, I am broken, your body will act broken. But if you tell yourself, I am recovering, I am strong, and I am learning, your body will respond with resilience. You are a masterpiece of engineering. You have survived every hard day you have ever faced, and you will survive this too. You are not alone in this struggle. There are thousands of us in this Wellness Roots Journey community walking this path together. As we move into our final segment, I want you to take a deep breath with me. Feel the oxygen moving into your hips and your spine. Let's wrap up with a final summary and a special message just for you. Are you ready for the finish line? Let's go. We have traveled a long way together in these 30 minutes. We have unmasked the rusty hinge of hip arthritis and tracked the electric lightning of sciatica. We have met the hidden imposter, the piriformis muscle, and we have learned the critical red flags that keep us safe. But most importantly, I hope you have learned that you are not your pain. Your pain is just a signal. It is your body trying to tell you a story. And now, you have the dictionary to translate that story. You know that if it's in your groin, you need to move the joint gently. You know that if it's a shock down your leg, you need to support your spine. Margaret and Mr. Henry are not medical miracles. They are simply people just like you who decided to stop guessing and start listening. They took small, consistent steps, and today they are walking, they are gardening, and they are living again. I want that for you more than anything. As we finish our journey today, please remember the 24-hour plan. Start tomorrow morning with kindness. Drink your water, move your joints, and breathe through the stiffness. If this video has helped you, if it has given you even a small spark of hope, please hit that like button. It tells the world that this information is valuable. And if you haven't already, subscribe to Wellness Roots Journey. We are building a community where growing older means growing stronger and wiser. Don't forget to tell me in the comments, what is your first step going to be? Are you going to try the pillow between the knees? Or maybe a short walk after lunch? I read every single one, and I am cheering for you. Check out our next video on the top 5 anti-inflammatory foods to help heal your body from the inside out. Thank you for spending this time with me. Thank you for trusting me with your health journey. Stay strong, stay curious, and most of all, stay hopeful. I am Juniper, and I will see you in our next journey. Goodbye for now.